Hi, I'm Kasha. I'm doing my abdominal assessment remediation. So, first starting off, I would do some hand hygiene at the door, knock, and introduce myself. Hi, my name's Kasha. I'm a nursing student. I'm here to do my abdominal assessment. Obviously, give them privacy with a curtain or with a door. Um, can you verify your name and date of birth for me? Perfect. Miss Jane Smith. All right, Miss Jane. I am here to perform an abdominal assessment. First, just want to ask you some questions and get to know your medical background. So I would ask them, do you have any medical conditions? What are they? And then really specifically focus in on like the GI and the abdomen. Like, do you have IBS, IBD? Do you have GERD? Have you ever had gallstones or gallbladder issues, liver issues? All those sorts of questions. Additionally, I would also ask about surgical history. So I'd be like, have you ever had your appendix removed? Have you ever had abdominal surgery? Have you ever had a stoma placed? Stuff like that. Start getting those questions flowing. Additionally, I would ask, are you on any medications? And if they say yes, depending on what it is, I'd ask them what they're taking it for, just in case they say no, they have no medical conditions. And then since I'm doing an abdominal assessment, I would also ask about like what GI symptoms they're experiencing. Are they in any pain? When did it start? How long has it lasted? Does it spread anywhere? Has this ever happened before? I also consider GI, GU the same thing, so I'd also ask them about their being able to urinate, passing stool. What does it look like? What does it smell like? Is it on a regular basis? Is it more frequent? Is it less frequent? Is it not happening at all? All those sorts of questions that are very pertinent. So, after I asked all that and assessed all that, now I would actually perform my abdominal assessment. So, firstly, I tell her, Miss Jane, I am going to do my abdominal assessment now. It will involve looking at your stomach. I'm going to take a listen to your stomach, and then I'm going to do gentle palpation on your stomach. Does that sound okay? Perfect. Sounds great. So, Miss Jane, I'm going to lay you back and lay her supine. So I'm just going to lay you back, get you into position. Let me know if anything hurts or you feel uncomfortable. All right, let's see. I'm going to have to change. Hold on. Sorry. So, lay her supine. Sometimes bending the knees helps, but she's a mannequin, so she's not going to. That way, her abdomen can just be as relaxed as possible. Obviously, I did all that with my gloves on. Definitely did not see that. All right, Miss Jane. So I'm going to lower your blankets, keep you covered as much as possible, and just expose your abdomen. All right. Let me know if you feel uncomfortable or cold at any point. All right. So I am ensuring that her chest is covered and her genitals and legs are as covered as possible. Wait, you can't even see this. This is probably like the most chaotic video. Ugh, jeez. There we go. Does that look okay? Okay. This is so hard to get a good angle to film. Alright, so just her abdomen's exposed, keeping her covered as much as possible. Alright, so first I'm going to inspect the stomach. Obviously looking for the coloring, looking for any discoloration, so like bruising, jaundice, the colon sign or the Turner sign we just learned about. Looking for the texture, like is it patchy, dry? I'm going to say this looks nice and moist. Normal skin, as you would say. Symmetry. It should be symmetrical on both sides, and additionally, it should move as you breathe in and out. Looking for any abnormal masses, and then additionally, I'm looking at her stomach shape and contour. So she's, I would say, flat. The other ones would be like rounded, distended, scaphoid. Additionally, I'm looking at her umbilicus, and I'm looking for any herniations. Because that would just be painful and ouchy, and that is something that you should definitely let somebody know. So, after that, I am going to auscultate bowel sounds. Miss Jane, I'm going to take a listen to your stomach. So you'll feel my hopefully not cold stethoscope on your abdomen. This is a clean stethoscope. I did clean it. So I'd listen systematically. I like doing clockwise formation just because it's easiest for me. I think you're supposed to listen for a full minute, but for video purposes, I won't unless you want to be here all day listening to me. I hear bowel sounds. I also hear bowel sounds. I hear more bowel sounds. And I hear more bowel sounds. Obviously, you're placing the stethoscope gently against the skin, because if you press too hard, you might not hear anything. Make sure I'm listening to in all 4 quadrants. And then you should hear about 5 to 34 bowel sounds per minute. That's the normal rate. And then, hyperactive bowel sounds would be 34 or more sounds a minute, and hypoactive would be less than 5. And to declare absent bowel sounds, it would have to be, you have to listen for 5 minutes. From my understanding, on all 4 quadrants. Listen for 5 minutes on all 4 quadrants. And then at that point, you'd probably get another nurse to double check your work. Alright, so next I would palpate. Alright, Miss Jane, I'm going to start touching your abdomen. Let me know if anything hurts or if you feel uncomfortable at any time. So with this, I'm just going to use my finger pads and gently press in about 1 centimeter. Because as nurses, I looked up on the ATI, we don't do percussion or deep palpation. That's only done by advanced practice providers. So I'm going to gently palpate on the stomach. I would save the last one, the last place it hurts, or the last quadrant that has pain as last. Yes. Ooh, that's like a tongue twister. Alright, so I'm just going to gently palpate. Any pain there? Alright. Alright, so I'm looking for any tenderness, masses, or involuntary guarding where like her abdomen is contracting up on her. None has been noted. Let's see. Now I would cover her back up. Alright, Miss Jane, that is it. Let me cover you back up. I would take my gloves off, do my hand hygiene, swish, swish, swish. Gonna bring you back over here. Oops. Alright. I'm gonna sit you up, get you comfortable. Obviously, call belt is in place. I like how my face was in that the whole time. Call belt is in place. I'm gonna lower the bed to the ground. Ask her if she needs anything before I leave. I think that is it. I know for my actual test, the part that I got wrong was ordering percussion, and which we don't do as nurses, only advanced practice providers do. So, yep, I learned my lesson. Even though it was an option that I had to do it. Anyways, I believe that is it. Also, tape measure would be helpful if they had any scars or stomas, just to measure out like the size of things. I believe that is it. That's all I have. Thanks.